Yeah, so we decided to introduce a video version of the Escape Pain program for quite a number of reasons, but the main reason behind it was that we had just gone into the lockdown with COVID. Um, as such, as we all know, there was limitations in people accessing services and the care they needed at that time. So we had many people who had their appointments cancelled. We didn't necessarily have the access to I suppose facilities and resources to do a lot to begin with. So a lot over telephone. While we had moved into lockdown, we still had obviously waiting lists that were there beforehand. There was many people who, were having their care paused or cancelled completely. Many people who were going to avoid accessing any form of support, and people were isolated at home in their own homes. So we looked at how maybe we could implement something that would be accessible during those time periods, and we'll be able to support as many people as possible, not just from, I suppose, managing their condition, but also as that, I suppose, general support and connection while they were quite isolated at home, which we know can have significant effects on people's health and well-being longer term as well. So at that stage in Cardiff and Vale, we weren't delivering the Escape Home program at all before COVID. So it had been on the radar to I suppose start to implement it in person before COVID, but it hadn't got to that stage yet. So we saw it as a good opportunity to, I suppose, reassess the way we were delivering care for these patient groups. Um, and I suppose it was a good opportunity, although it created a lot of problems, COVID. It was a good opportunity to just rethink how we were doing things, and and for the better more than anything. So that was kind of the catalyst for the change, really. We were kind of pushed into it, but a welcome push. So we've carried on doing a video version of Escape Pain ever since we started it back in October 2020 initially. Um, since then, we've had a big increase in I suppose the scale of our delivery of the program. So it has moved out to leisure facilities back in October, November of 2021. So once we started to come out of lockdowns completely, we moved towards more of a community delivery, which sits in line with, I suppose, national and local health policy and our own rehabilitation model to move services away from acute hospital settings to the community to make it more accessible for people, and closer to home, in an environment which is more appropriate for that type of um, care provision, really. However, we have kept the virtual option because there has been demand for it. So many people, it's easier to access. So people say that they can access it from work in the office. Many people are continuing to work from home, which was instigated by the pandemic, but they still do days at home or full time at home now. So it's much easier for them to, I suppose, take that time away from work of an hour or an hour and a half per session, rather than having to, I suppose, take a number of hours out to travel to and from appointments or sessions for the program. There's lots of people as well who might have difficulty attending programs in leisure facilities, although we have moved it closer to people's localities. um, People might lack access to transport, and that, so they find it quite helpful as well. And also there's people who may have some, I suppose, social anxieties as well about being out and about, and still maintain following the pandemic, but also in general have potentially been isolated for a number of years, which then allows them to be able to access uh, such a high value program um, from their own home. Some people report feeling more comfortable in that environment at home, so familiar environment for them, and feel more comfortable then to engage as well. rather than being in, I suppose, a group setting in person as well. So there's a number of reasons why we've kept it. Um, there has been a reduction in the level of referrals for it, for the virtual component, um, due, I suppose, to the success and the scale at which we've rolled out the face-to-face aspect of it. But there's is still demand, so we have continued to run it from the physiotherapy department as well. So overall to date, we've delivered approximately 20 virtual escape pain programs over a 2-year period overall. So the design of our virtual escape pain program is very similar in nature to the face-to-face delivery. Obviously, there's different aspects in terms of preparation for each session. The length of time that we allocate per session is different, and there's a lot of I suppose IT and administration tasks that fill up maybe that extra time before and after each session is delivered as well. Overall, the program we have continued with delivering 12 sessions overall. Um, the sessions themselves are approximately an hour and 15 minutes. Um, However, at the beginning, our sessions could be much longer even due to the fact that we were working within kind of COVID restrictions, and we had a bit more time available to deliver sessions. So with people, I suppose, being quite isolated, it meant that when they were meeting as a group and connecting with one another, there was a lot of just general socializing going on because they were probably isolated and didn't have that aspect of their life at that stage so much. Um, People tended to be, quite happy to have a chat, and the the discussion aspect of it at the start could be even up to 45 minutes, and we didn't necessarily have a significant time restriction. So then following that, we would do exercise together and have a chat at the end. So it was a bit more ad hoc and a bit more relaxed and natural, really, to begin with, which led to, I suppose, people developing those relationships with one another, and continuing to meet after the programs had finished completely as well. Um, so now, currently, what happens is we generally start to set up for each session about 15 to 20 minutes beforehand. Before the very first session, we tend to start a bit more in advance, so about 30 minutes before the session, just to ensure that everything is working and set up. Although we've delivered many programs to date, we still check, obviously, the IT is all in hand at that stage, rather than waiting till 10 minutes before the session to make sure everything is working. And then the first part for the first session in advance of say our official start time is utilized to ensure that all the participants are able to access via the we use Microsoft Teams, so able to access the link, have their sound and their camera ready, etc., and they're able to work everything. And if anyone has any difficulties, then we can just give them a phone call and talk them through it as well. Although we do provide a an overview of how to access via the link in case anyone has any difficulties. Um, so then the program itself, then the session is like any other escape pain session. We have the discussion aspect at the start, which is not necessarily, as I say, time restricted. It can last somewhere between 10 and 20 minutes, depending on questions and discussions and how much the flow of the conversation between participants as well. And then we move on to our exercise component, which can vary from session to session depending on participant choice as well. And we deliver different types of exercise throughout the 12 sessions overall. And as the sessions develop, allow I suppose not allow, but encourage the participants to take more control of the exercise as well. So to be able to decide on what we're doing, what exercise is next, what they would like to do, because then it has more of I suppose, a meaningful long term uh, motivation around what activity they want to do as well. So getting that self-efficacy for the activity or exercise as well, and choosing what they want to do. Um, and then at the end, we have a bit of a recap as well. Um, Answer any questions that people might have around the exercise or the discussion that we had, and then we always allow um, a little bit of extra time at the end in case anybody would like to have a one-to-one chat about anything that they might be struggling with or concerned about, and if that needs to move to a phone call or to a separate video call with them, then we have the time to be able to do that. But overall, we tend to take somewhere between, I suppose, an hour and a half generally per session, including the the bit before and the bit afterwards. But that can we allocate overall about 2 hours to ensure that we have that bit of leeway in case anything crops up as well. So our recruitment process for the virtual program, initially we recruited directly from the secondary care physiotherapy department at the start of when we set up the virtual program to begin with. To facilitate this then, moving, I suppose, more towards a self-referral service. What we did was we set up more of a we set up a web page on our what we call our Keeping Me Well website, which was set up at the beginning of COVID to have access and resources for people to be able to view while they're maybe waiting care or as self-management strategies, which is a longer term project. But we developed web pages on that website, and on that then we have a referral form that people can complete themselves. So it, I suppose, provides that responsibility as well to and make that decision to refer themselves, rather than it being which has traditionally happened is people, I suppose, are referred or advised or told to come somewhere, and may not be actually prepared for what is involved in that referral, and I suppose what's important to them to achieve from that referral. So essentially it's moving back towards empowering the person to make the choices that work for them. So essentially we're a self-referral service, but it's generally people are directed towards that following a consultation. um, as services have opened up more and more over the past couple of years, and as we've spread and scaled the program out to face-to-face delivery as well, and as we've, I suppose, promoted and marketed more and more, um, it's, people can be directed to refer themselves from primary care, from GPs and nursing staff, from our FCP colleagues in primary care. They can be directed from social prescribers. So we've done some work from that aspect as well. So social prescribers in different localities are aware and can highlight the program for people that they might encounter. There is, in our clusters, we have got many different professions that are becoming more and more aware of it as well, so they can direct people towards that as an option for them to be able to manage their joint pain, and learn more about that. Um, and it's also signposted from our orthopedic colleagues. Um, so the orthopedic consultants, when they see people in clinic, they can signpost to the web page as well. Um, and also we have a GP clinical lead for orthopedics who triages referrals that go directly from primary care to secondary care to orthopedics, and they that GP also offers the program and directs people to the web page at point of referral as a management strategy, rather than waiting on that big long waiting list to see orthopedic surgeon, and it may not actually be, a management option that the person takes up or is offered at that stage. So it could be waiting, a year for that appointment, whereas actually they can be signposted to refer themselves to the Escape program, directly at point of referral there as well for anything that gets through that direction. So really, as we've marketed more and more and promoted the program and demand has increased, the awareness of it across the health board has increased, and as a result then people can access. We have that ease of access for the person who wants to refer themselves, but also an ease of referral from the I suppose the person they interact with, maybe in healthcare, that they can easily signpost it as well, which means that um, I suppose it's not a big administration task for somebody, for a healthcare professional either. So it's makes access a lot easier, and signposting a lot easier then as well. So the efficiency of running the program virtually, from a staffing and from a clinical aspect, it's quite efficient, because what it means that uh, the clinicians delivering the virtual component of the program essentially can run their clinic in the morning if they have a one-to-one clinic in secondary care, and then from there they don't necessarily have to travel to our leisure centres to deliver the program. So having to travel off-site, which includes obviously travel time, um, and then obviously traveling back to clinic as well. So that aspect of it is cut out. So somebody can easily just finish up their clinic, and on the same site then start the escape pain session, and then finish the session, and having enough time to finish off whatever we need to do after the program or after the session, and then go back to clinic as well. So it's quite time efficient from a clinician aspect. um, Also, I suppose in terms of time efficiency, it means that and in terms of value, the one clinician with a support staff can deliver a session to 10 people in an hour or an hour and 15 minutes, which is of greater value than maybe a one-to-one session for one person, obviously, in maybe 30 or 45 minutes. So the value of being able to deliver you know more sessions to more people um, in a similar time period obviously has significant degree of time saving as well. So in terms of the outcomes that we've found from delivering the virtual escape pain program, the initial outcomes, although quite a small sample size, were significantly actually above the I suppose the real world clinical outcomes research that Escape Pain have completed, and obviously with a small sample size, but there's probably many different reasons. Again, at the beginning, people were quite isolated. As I said, we had probably longer time for sessions. It was very much socializing a lot of the time as well for people, as they were isolated at home, and probably a number of reasons other than that as well why maybe outcomes were quite significant. So we're talking about the who's and who's, so significant improvements in pain, function, and quality of life across those. As we've delivered more and more programs, and uh, as the, I suppose, sample size has increased as well, we found that there's generally a similar outcome between delivering the program virtually and delivering it face to face. So the specific who's and who's outcomes are quite similar in terms of the improvements. Statistically significant improvements in pain and function and quality of life um, across both programs. But again, virtual and face to face have been quite similar in that as well. In relation to attendance data, so we've done a lot of work around this, and generally what we've found is that a higher percentage of participants, once they start the virtual escape pain program, a higher percentage complete more than 75% of the sessions than might complete the 75% of the face-to-face sessions. So generally, we, like any service, you have people who are booked on but don't start the program. But once people do start the program, it is more people do attend more sessions virtually and continue to attend than we found face to face, probably because of the ease of access. And that's why people have probably chosen to access the virtual aspect as well rather than face to face. So it's easier to just pop onto the computer probably than go to a location probably. So that's a huge benefit of the virtual model as well. The feedback and experience of participants in the program being delivered virtually has been quite positive. So if we look back to the very first cohort that was delivered in October, November 2020, um, the group has continued to meet actually on a weekly basis since then, for one session, 40 minutes once a week, to catch up, continue to support one another, and exercise together online. Um, and although there is options for them to attend different programs and different, I suppose, management strategies and options, and peer support groups, even face to face, they have developed relationships together and continue to meet online. They've reported that, that team work aspect of it, to be able to share difficulties with one another, and that support is really what they've gained so much from, um, when they attended the program virtually. And it works well for them then to be able to pop on for 40, 45 minutes once a week, catch up together, and then do the exercise together. um, they've, one person quoted that, just to quote one person, they said that they see it as a team together, supporting one another, and it's a problem shared, that they can, I suppose, support each other if they have any, questions or queries, or need some advice from one another, which is a key aspect of having, a peer support network outside of healthcare, who can support one another, and give each other advice, which means that they might necessarily have to access any healthcare service to receive that, I suppose, advice and reassurance as well. Um, so the delivery of the program virtually has been received really, really well. And I suppose participants really value the aspect of being able to have easily meet with one another afterwards as well. And that's what's really been promoted, to have that peer support longer term, which then results in a longer term maintenance of behavior change, and continuing to live well with their condition, rather than struggling, um, suffering, and continuously having to access healthcare for support. Um, in terms of the experience of our team and my own experience in delivering the program virtually, initially there was naturally some degree of apprehension around it, because we're so used to providing sessions and programs like this in person. But naturally everybody kind of came together to be able to put together, a quality and high value program, to still have that, I suppose, that option for people who would find it easier to attend virtually than in person, and still have that option for them while they were, I suppose, struggling during the pandemic. My experience has been quite positive. It's been very, very enjoyable, and we naturally develop those kind of, those that rapport with people, and the relationships, and you see the value then, from the program then as well, when hear about the stories from people afterwards. We've done a lot of work on trying to collect the people's voice basically, and their experiences, and to hear, the real success stories from people after attending the program, um, has been, quite heartwarming, really, to see how people have continued to support one another. And it's been quite a positive experience in that regard. um, and people, even saying that they've made friends for life as a result. That's then, I suppose, been quite a catalyst for change in general, and we've utilized our experiences from this to be able to transfer that over to our face-to-face delivery, and developing lots of options and peer support networks, as the norm, in terms of follow-on options for people within their own communities as well. So the virtual program, really, and starting that up a couple of years ago, has really been quite a catalyst for change in relation to how we deliver care. Um, So it's been quite a positive experience overall. We've had a lot of learning from delivering the virtual program as novices to begin with. So we do have quite a lot of top tips really to I suppose give a bit of clarity and maybe some advice to people who are I suppose considering delivering the Escape Pain program virtually. Um, the the key thing that I would say to begin with is develop a sense of shared responsibility, and a more of a team spirit around it. So generate that enthusiasm and use that energy and run with it, and that then leads to a happier team to be able to manage any challenges that might arise as well when you start anything new, um, and essential thing as well is to ensure that all people involved can complete all tasks, so that then if you do have any difficulties arise and you have different staff not available at the time, that anybody can manage any difficulty that can arise. So um, clinicians able to do all admin aspects of the sessions as well is really really important. Being organized from the start with some clear processes is very very important. We've refined our processes over time, um, from the learning we've had, but having clear processes, being organized, having a structure to the preparation for sessions, and having enough time available to initially to be able to refine those processes, and troubleshoot as you go along, can be quite helpful. One of the big tips that I would provide would be to have a clear mode of contact for people as well, so that when they are trying to get in contact, even just for unable to attend or for information sharing across, to have a sole email address rather than it coming from directly from a clinician email address. So if they're not off, the message gets lost, etc. And it means that people have an easier access to information that we're sending, but also to contact us easier rather than having to go through the administration booking system, and calling up and waiting, etc. And then that takes that load off the administration staff then as well. Um, Developing resources and having them readily available is really important, and having a central location, so a web page, working with your IT and comms team to be able to develop those resources and have them at a central access point has been very very helpful for people. It has helped with clinicians in terms of being able to to provide information to people if they're considering attending the program, and also help with shared decision making discussions to provide that accurate detail around what the program involves, and people can go and look at it then and decide on whether they want to refer themselves then as well. Um, in terms of timings for the sessions as well, um, what from our experience and what I would advise is that longer sessions have a significant benefit. So the longer the session, it tends to flow easier. It's more relaxed because there's quite a lot to get through in some of the sessions, and if you're trying to fit it all in, it can become a bit rushed. People don't have such a positive experience. Having more time really allows people to um, share and discuss and respond to one another throughout the session, particularly the very first session. So when people are accessing for the very first session, uh, there can be IT difficulties. There can be obviously a lot of information sharing to begin with, and just having that time, that extra breathing space to be able to manage any of those difficulties is really really helpful. So I would even advise up to leaving yourself a 2 hour period to be able to manage the first session, and having given people that time in the first session to share their story a little bit, to be able to introduce themselves and discuss what they want to get from that. It gives that platform for the rest of the sessions, for people to be able to feel more comfortable, rather than it being quite intense to begin with, which can be a bit off-putting naturally for anybody for the first session as well. Um, as the sessions go on, and as you get more experience in delivering the program, um, virtually, um, you may find that there's less reliance on the slides as you go through. So as you get more confident in facilitating virtually, which is can be have challenges in relation to that in comparison to in face to face. You might have less reliance on slides, being able to develop more of that group conversation as well. Um, in terms of that, then, so looking at the facilitation of the sessions. It can be challenging. It's different in terms of developing that rapport across participants. So we all know there'll be people who are quite happy to share, and other people who might be a little bit more reserved and take a number of sessions maybe to come out of their shell. So rather than, I suppose, trying to fill those uncomfortable pauses that may happen. So those silences, try to engage them, or sorry, embrace them a little bit more. Allow that time for people maybe to reflect on what you've said or what somebody else has said, so they can maybe formulate what they want to say as well. And it gives them that breathing space as well, rather than what could easily happen would be a return to that more educational directive approach of providing information rather than it allowing to be facilitating a flow of a discussion. um, would be it would be detrimental to the quality and value of what we deliver as well. um, in terms of being able to evidence the benefits of the program, really try to document success stories, participant stories, their feedback as well on the program and what they have found helpful from it. And also if there's any advice on terms of improvement as well. So always listen to what people have to say. Use those stories then to be able to evidence the value of what you're delivering, and use that peer voice. So you know developing more of a bringing people back, so people who've graduated from the program, bring them back to sessions, bring them to the first session, get them to join in, get them to deliver exercise as well, um, to people when they're starting off who might be a little bit apprehensive about doing things. It provides that lived experience from the person who's already participated in, has gained benefit from, and is now living well with their condition. So to show that what can be achieved from attending the program, um, that can be really quite empowering for people who might find that you know they might have some reservations around it. They might have a lot of reduced confidence in being able to participate in any activity or exercise, and that can be quite empowering to hear a real success story directly from somebody who's benefited as well. Um, and then I suppose one thing that we've really worked on that has been quite successful is post-program options for people. So rather than it being, a 5 or 6 week program, which is, obviously we know it's effective. We know that people do really well from it. Um, the key is to have that maintenance options afterwards that sustains that benefit that people have, and to continue to improve and progress. So developing, I suppose, from a virtual aspect, developing maybe some connections within local communities, so community groups, activity groups, even developing peer support groups within the community, which either can be virtual or meet face to face. Developing relationships with local leisure facilities, so that you can have that connection basically for people after they attend the program, so that they can continue engaging in some sort of activity, and whether that be together with people who have the same condition as them, or whether that be just attending themselves to some sort of group or program or exercise or activity. Could be a gardening club, it could be a water aerobics, it could be anything. So we know that the benefits of participating in an activity in a group have in terms of general health. So having that kind of options for people afterwards, the more options you have, the more likely somebody is going to find something that they enjoy doing as well. So that's something that we've really worked on, and I found that it's really been quite successful then as well. So my advice to anybody who might be thinking of introducing Escape as a virtual program is go and do it. Embrace the fact that it's a different way of working, but it is a valuable option for people to have. Um, it can feel very, very different. It can feel quite challenging to begin with, but if you come together as a team to be able to, I suppose, plan properly in advance, organize what way you want to approach this, um, use the top tips that we've provided, and the information that we've learned. It can be quite a journey, and it's been a journey for us to I suppose learn from challenges that have arisen. It's not all been smooth sailing, but we've managed to get to the point where we are today, with a lot of success stories, and successful programs have been delivered over the past 2 years. So essentially just dive in, go for it, and it will be beneficial for everybody involved.